hit the recording button on this. So first of all, I'd like to say thank you to everyone that's on the phone joining us today. And before I introduce our guest speaker, just want to remind everybody that we've got two options for asking questions throughout the presentation today. Please feel free to ask your questions either in the chat room or in the Q&A box. It should be down at the bottom of your screen. So feel free to ask those questions. And as we continue going, I'll keep a track of the questions as they come in, and we'll certainly allow for some Q&A. This is a call for you to learn, and so please don't hesitate to ask those questions that you may have. So with that, I would like to introduce to you today Alexander Masterboy, who is board certified clinical thermologist. He is the founder and president of Thermography Clinic Inc. that I am so proud to work underneath and with. He's a former doctor of homeopathic medicine. He's an author, researcher, and a public speaker. He has been recognized as a leading authority on the application of clinical thermography and has lectured worldwide in both Europe, North and South America on the many aspects of clinical thermography. He is a wealth of knowledge, and I am so pleased to have him here with us today. So with that, I'm going to pass it over to Alexander.
Thank you. Thanks for inviting me.
So some of the questions we have today, I mean, the topic is, breast health and thermography. Mm-hmm. And so I've got some questions that I thought, oh, one second, we've got a question here. Good afternoon, is there any way I can turn off my microphone? Yes, Olga, if you actually go down to the right-hand corner of your screen, you should be able to, but one second here, let me see if I can. I can't disable it for you, Olga. Not unless you have somebody else in the house that's joining this too, and you might be getting some feedback. But your microphone should be shut off. Okay, sorry about that. So we'll get back to this. So the questions that I have prepared are some of the questions that, I get asked a lot as well too in my clinic. So I'll ask you some of those, and then again, we'll be looking for the audience to ask us some additional questions as we go. Okay. So first of all, for those on the phone with us today that may not know what thermography is, right? That is the number one question I get, so what is thermography?
Thermography is a science that looks at measuring body temperature. Just like you're measuring your temperature when you have a fever, we're using 78,000 thermometers that are basically, we're using a sophisticated equipment with infrared cameras, and each individual pixel has a measurement. So we're looking at different heat patterns, and by looking at different heat patterns, we can understand what exactly is going on. So thermography came into existence from military application after the Second World War. And then actually it was really the first thermography, breast thermography study was published in Canada in McGill University Medical School by a physician by the name of Ray Lawson, who kind of had an idea that most likely breast cancer is going to show up with heat. And I don't know how, but somehow he got a hold of some form of equipment and used thermography to show that indeed, in the majority of cases where women did have breast cancer, they produced heat patterns along the breast. So we can use thermography for breast, we can use thermography to look at different applications, upper body, lower body, all sorts of inflammatory conditions will show up very well with thermography, such as, let's say, arthritis or any kind of inflammation where you have a temperature differential. So thermography looks at the surface of the body, and when we capture those images, we're looking at them and kind of figuring out, well, based on this, what exactly is going on inside, because all of the heat has to come to the surface of the body. And that's, in a gist, what thermography is all about. It has no radiation, There is no contact. And I always joke with patients that come to my office that for a change, you are radiating me, right?
That's true.
So it's completely benign, and yet it's a very, very powerful way of seeing something that really is invisible. We can't just look at people and say, aha, you have a fever. Probably they display other signs when they have fevers, but usually when you kind of use a kind of an unsophisticated old-fashioned thermometer, you can tell that there is a temperature difference from normal. Well, we can actually stand many feet or many even meters away and get that temperature. And as a matter of fact, in this day and age, and I remember in the old age, I should say good old age of SARS in Toronto, we had thermography cameras in the airport looking at people's temperatures as they're entering the airport. So we can kind of see who has fever and who doesn't.
Yeah, I know that I've just recently received an invitation to attend another call where many companies, right, for the banks and some of these essential services that have to stay open, they're looking at putting in place thermography cameras as well too, to help, ensure that they're tracking the employees and stuff that have to show up for work every day as well too. So, so let's talk a little bit about breast thermography in itself. So, the process, right? So there's a couple of things that are really important when you go for a thermography scan as it relates to your breast. And that is the process that we follow, right? The cold water challenge and why we do that. And the temperature of the room, that it's, very important that we follow those very specific protocols.
It is important to follow specific protocols, but basically it's very, very kind of simple procedure where a woman walks into a temperature-controlled room, gets disrobed, sits there for 10, 15 minutes to get acclimated because, the outside temperature will affect your body temperature. So we don't know whether it's the winter or the summer. So that's why someone that needs to sit in the room for 15 minutes just to get acclimated, and then a series of images are being made. We can get into cold water challenge if you wish, but at this point in time, basically, once those images are done, they're being sent to our remote server. From there, a bunch of doctors, and myself included, may be looking at them to analyze. We'll write a report and send it back to you. So the main premise of thermography is that, first of all, it doesn't replace any other test. I just want to make everyone understand that. It's a very, very different technology. Unlike things like mammography or, let's say, ultrasound or MRI, which are not completely benign, thermography is benign. There's no, as I said, there's no compression, there's no radiation, there's no contact, but we're looking at the way physiologically your body is functioning. Because if there is going to be a change in the functional level, in other words, just like with analogy that we gave with fever, how do you know that you're sick? Well, you generally, if you have a fever, most likely something is going on. So if we see an unusual pattern, or if we see a hot spot on one breast and not on the other breast, that does not necessarily mean that there is an issue or malignancy, but it means that there is some kind of a risk involved here. And what I'd like to use thermography as simply as an extension of a physical examination, just like when you go to your family practitioner, and whether it's once a year or whatever, they kind of give you a complete physical. Well, this is an extension. As I said, we can see with thermography something that's invisible. In other words, hot spots here and there, and pertaining specifically to breast, all it is a statistical probability of risk. So we rate our images or our analysis and reports that eventually get back to the patient. We rate them based on a TH scale. TH scale is an international scale that stands for thermography. TH1 is low risk, TH5 is high risk, and something in between. So someone with low risk has a very, very low probability of developing breast cancer. Someone with high risk obviously has a higher chance of developing breast cancer, and something in between. Mm-hmm. Now, you can say, well, what do I do with this information? Well, what you do with this information is that, let's say you're medium or high risk, you can sit down with your healthcare provider and figure out what contributes to that risk. So in this way, thermography acts as an impetus for change, right? You may not have symptoms. Obviously, most women with breast cancer do not have symptoms until it takes years, and sometimes even a decade, for a mammogram to actually see the lesion that has to be large enough. But if you don't have symptoms, how do you know that you're at risk? Right. Well, you can sit down with your healthcare provider and say, well, is it my hormones? Is it my lifestyle? Is it my diet? There's so many different variables that you can look at how to minimize your risk. And then you can come back 6 months later or a year later, get another scan with thermography and see, are you stable? Are you getting better? Are you moving in the right direction? Or some kind of a process is going on where you're not moving in the right direction. And obviously we can always escalate. And once we see that the risk is rising.
Mm-hmm. Absolutely. Yeah, and thank you for sharing that. And for the folks, on the phone, I certainly don't mind sharing my story as well too. That was, kind of my take on it when, I found thermography, or it found me, I should say, because during that time I was, starting to have some issues and, burning and just weird things that were happening that wasn't normal. And so I knew that. And so, I went to my doctor and I had, a mammogram done, an ultrasound, and, again, some inconclusiveness, but then through thermography, I was able to determine what was really happening, in my breast, and was able to make some of those lifestyle changes that helped me immensely to, course correct being a medium risk, and moving myself down into a lower risk, right? So, so certainly for me, that was, my story, and certainly I know countless other women's stories as well too, as I continue to work with people. It's just being able to give yourself that runway to make change. So I appreciate that. You've answered a couple of my questions. Let's talk about, one of the things I want to talk about too is, so we talk about breast thermography, but also the need for follow-up, right? So, having that baseline, why that's so important to have that baseline in the beginning.
Well, you want to have another point of reference, right? So what do we compare this to? So say I look at your image and I say you are TH2 or TH3, low risk or high risk. How do I know what's normal for you unless I have some history with you, right? So because I don't know what's normal for you, we will ask someone like yourself to come back, let's say in 9 months or a year, unless you have something disturbing or some symptoms that you want to check out earlier. So when you come back the following year, I can look at the new image versus your baseline and say, aha, you're stable, or you're getting better. What is it that you're doing that, kind of lowers your risk and improves your image from our point of view? Right. You may say, well, I changed my diet and, I got rid of junk food or whatever, or I got my hormones balanced, or I started exercising, or, I lost some weight, or I got my thyroid fixed, or, we can get into so many different things if you like. Mm-hmm. So what's important is to see whether or not the therapy or some kind of a lifestyle change that you have made, is it really effective for you? That's very, very important. And what if you're not moving in the right direction, right? I told you last year, well, you're kind of medium to low risk. Oh, thank you. great, I'm going to go and every time I pass by McDonald's, I'm just going to get those French fries. Nothing against McDonald's. So maybe a year later, when I see you, I'll say, you know what, something is going on. You're really not moving in the right direction, and you're not even stable. So I'm concerned. Either we're going to escalate, and of course, most likely we will escalate at that point to make sure that you don't have active disease. But I think it would be important for you to know what exactly is pushing you in the wrong direction as well. So that's where the follow-up is very important. Actually, to me, the follow-up is even more important than the baseline, because it gives me an understanding of, as I said, whether or not you're stable, if you're moving in the right direction, if you're moving in the wrong direction, and exactly what's normal for you. I may say and look at this and say, well, I have a few questions here and there, but if that's consistent and it's stable year after year after year, that's your normal. And we're all different. I've looked at probably way over 40,000 patients by now with, with breasts and full body. And I can tell you that not one breast is identical to another breast. It's almost like looking at fingerprints. Every woman has a slightly different breast. And what's normal for you may not be normal for your next door neighbor.
Right. Yeah. Which is so important for that follow-up, for sure.
Yeah.
Can you talk a little bit about, so I know you've seen 40,000, what are some of the things that we see? I mean, obviously it's not a diagnostic test, but more of a, suggestive. So can you talk a little bit about some of the things that we see as we do these scans for people?
So first of all, most of our kind of clients, patients are usually women in the perimenopausal to menopausal kind of age bracket. We do see more and more younger women, which is I think it's a positive thing, but unfortunately more and more younger women do get breast cancer.
Right.
Matter of fact, it's number one cause of mortality for women around the age of 35, number one. We're not talking about that in the media because the emphasis is screening older women, right? 50 and up or 45 and up. But yet younger women have a much denser breast tissue, and therefore mammography is not really an appropriate test for it. Women, in many, many cases, will have fibrocystic breast condition, where you have cysts and fibroadenoma in the breast. Again, it's common, but it's not normal. Many women we see with hormonal issues, where they are in a so-called estrogen dominant state, and therefore excess estrogen will lead to vasodilation. Again, when it's normal, it means that vasodilation is going to be fairly symmetrical in both breasts. But when it's abnormal, it's usually more kind of in one breast versus the other breast. So here we have to kind of look at this more carefully and say, why is this area hot and the opposite side of the opposite breast, the mirror image of the opposite breast, is cold? Is this the way she is? Is this her normal? Maybe she's been like this for the past 25 years. I'm just looking at it for the first time, given that we don't just looking at the baseline. But what we also see is, in many cases, as I mentioned before, some women with the help of thermography can trace and kind of navigate what's working for them, whether they are in trying to prevent, or even if they have kind of active disease process, we can look at and say, yeah, you are getting better, or maybe the therapy that you are decided to do is not effective for you. And from our standpoint, you're not really moving in the right direction here.
Right. Right. It's shocking, to hear though too, right? That the number one, killer of people in that age range, right? So it's 30 to 35, or is it 35 range?
I think it's around 35-year-old women, right? Because again, no one is screening them. No one is talking to them about breast health, because the assumption is that they're young, and because we can't use a mammogram, or for the most part, they're not really effective. We're just totally neglecting that group. And yet I've seen many times young 30, 35-year-olds in my office with active breast cancer, with a little 5-year-old, tagging along with them. And you can see the fear in their eyes. So do we just ignore this population, or do we basically say, from my point of view, I think every woman from 20s and up should at least get a baseline. And depending on their rating, if they're low risk, obviously, hopefully they will remain this way. But from time to time, they need to come back and recheck. Because these things, as I said, statistically, if you want to look back at even a century ago, we had very, very different numbers, but now it's 1 in 8, 1 in 7 women that will get breast cancer in their lifetime. And when it comes to overall cancer, it's closer to between, almost every second person is going to get some form of cancer in their lifetime. So something has changed in the past 100 or 120 years. And I believe it's totally environmental. It's not genetic, because genetically we haven't changed, but somehow we have affected ourselves with hormonal imbalance, with food that's no longer nutritious, with the soil that doesn't have nutrients, with animals that are commercially produced that are toxic. There's so much toxicity in the environment with 5G that's coming on. And this is probably kind of disease of the modern age, but somehow we have to deal with this. So
and it's I won't get off on my little tangent, but it's, the thing is that I've read a lot of studies as well, and that I continuously pour myself over well-written books and documents and studies that you've been doing yourself. And cancer doesn't have to be a part of anyone's future. It really doesn't. I read your book, fantastic information in that. You've got great articles out on your website as well too. And there's countless others that have done countless studies on it, and it doesn't have to be part of our future. Especially with thermography, understanding what's happening in your body, at the time, and making those lifestyle changes that you need to make to change that. I mean, I made some lifestyle changes myself, right? And that's what certainly helped move me out of a medium risk for breast cancer down to, a lower risk. And I'm not perfect. And every time I decide that I'm going to have, something that I know I shouldn't, I go, is it worth it? And sometimes, it makes you take a step back, because you are, as human beings, we are absolutely in control of a lot of things. Some things we may not be, like 5G, but that's, I know, for a topic for another day.
Look, we all want faster internet, that's for sure, especially in this day and age. It's so frustrating because everybody sits in front of their screen right now. But I'm not exactly sure that 5G is going to make us healthier. But again, you're right. It's
maybe we'll be like Slovenia and stop it and do the right thing by looking at. I know yesterday they made their announcement that they're stopping it in Slovenia so that they can do further testing to make sure they understand the impacts of human health. Right. So. Step in the right direction. Maybe we'll follow them. Anyways, we're here today to talk about breast health, and I won't get us off topic. Let's see. What about, here's another one, and I'm going to reach out to the audience here in a minute. So get your questions ready. Feel free to drop them in the chat box or the Q&A box here. Can we talk a little bit about, we talk about, overall health, right? overall health is really important to all aspects of your body, not just, not just your breast. So can we talk a little bit about dental pathology and breast health?
No, I was going to bring it up, but you beat me to it.
So one of my like hot topics, one of my big ones. So
Yeah. Look, the oral kind of cavity is the largest orifice in our body, and for some reason, there's a huge disconnect between so-called medicine and dentistry. Although it's the same body, there's been many, many studies, and I've seen it clinically myself, that oral bacteria happens to enter our bloodstream, not only when it comes to dental issues, but things like periodontal disease is very, very kind of much connected. And there's been documented studies that periodontal disease is connected to cardiovascular disease.
yeah.
And with time, we'll see more and more connections with cancer, specifically breast cancer. Why? Because anything that's going on here has to go through your lymphatics.
Yeah.
It has to drain through your lymphatics, not only affecting your thyroid here, but it will also affect your lymphatics down, kind of downstream into your breast as well. Things like root canals. In many cases, they are infected, but because we have severed the connection to the bloodstream, and we cut the connection to the nerve, you don't feel anything, right? But inside the root canal, it's almost impossible to disinfect this completely, just impossible. The bacteria that stays there, they have waste products, and these waste products are neurotoxic. So if you have root canals in the lower kind of jaw, specifically in and around these molars, that may affect your lymphatics and your breast cancer. And I see it clinically, not with everyone, but I see it in huge proportions. And when you have root canals in the upper jaw, when you're lying down, where do you think it drains? It drains actually into your brain.
Right.
So I just came back from a conference 3 weeks ago between physicians and dentists. And for a change, we're starting to talk to each other, where a lot of dentists are saying that there is a connection between the root canals here and Alzheimer's as well. Because where do you think it's draining when you're sleeping? Right. So, this is so far anecdotal, but I'm pretty sure that there is a connection, and at some point we'll have studies. It's very difficult to prove something that may take 5 or 10 or 20 years to develop, right?
Right.
It's much easier to construct, take a pill and look at the reaction and that it produces tomorrow. But if we have something here that interferes with our immune system, because the immune system needs to contain that. And now there is an overload of other things that the immune system needs to deal with. Not only we're weakening our immune system, but what is cancer? Cancer is basically a compromised response to, in a sense, I wouldn't want to say an invading army, but a bunch of cells that decided that they can't die anymore, right? So normal cells have their lifespan, right? They're called differentiated. So the cell in my nose knows when to stop. Otherwise, I would have a huge nose, right? And then new cells every single cell regenerates themselves within 7-year cycle. So you're a completely new person within 7 years. Some cells may regenerate themselves within hours or days, and some cells will take years. Now, cancer cells really don't die, right? So they continue to proliferate. And coming back to what it has to do with breast cancer, cancer cells require more nutrients, right? because they continue to grow, uncontrollably so. So those nutrients will have to come from the blood supply. That blood supply has to come in to feed the tumor. That blood supply is going to produce more heat. And this is where thermography can look at this and say, we have a hot spot here. Is this a problem area, or is there another reason for dilation of these blood vessels in this area? So yeah, the same thing happens with root canals, dental infections, all sorts of things. And unfortunately, and I know we've had this conversation with you before, but I'm going to ask everyone who's listening to this right now, when was the last time your family doctor asked you about your dental health? And if the answer is never, how come? Right?
Getting some responses, never.
Yeah. I mean, you know, to me, it's unfortunate that we have decapitated patients here. So from here on, that's the domain of your doctor, and this is the domain of your dentist, right? As if this does not sit on your neck, and your neck does not sit on your shoulders, right?
Right. Yeah. I mean, I just know, you know, in the short period of time I've had the clinic open in New Brunswick, right? Some of the scans that have come back and some of the clients that I have that would come in with certain issues. And then, you know, we do the dental cranial thyroid and see, you know, after they've had a breast on and do the scan and then realize that, you know, they had lots dripping down from their dental into their breast. And it was a direct line. I've seen, you know, a person that had it removed and the difference in her health, you know, that came after that was incredible. You know, she's looking forward to coming back for her scan in 3 months just to see what the difference is now based on after having it removed. And it's incredible to me, some of the studies that have been done linking, you know, the dental with other health issues in the body. And like you said, especially too, you know, from a cardiovascular perspective, it's not something that's widely talked about. And again, it's the only, you know, part of the body that we put back in that's dead. You know, I watched a program, I think it was on Root Cause, I think is the name of it. And it was a documentary that was done, and they had talked a lot about the fact that, and there was doctors talking about the fact that we put something back that's dead into the body, right? It's the only thing that we do. All right, so we've got a question. What is dental cranial thyroid cause? What is the dental cranial thyroid scan? Do you want to?
Sure. So just like we're looking at the breast, we're isolating this area, including your neck and up to the clavicular line. We want to look, some people have, especially in the wintertime, they have some sinus issues. Are these chronic? Are these really sinus issues, or are these issues coming from dental issues that are affecting one's sinus? People may have migraine headaches. There are certain patterns that we can look at and say who is more likely to develop headaches. Then we're looking at the thyroid as well, which is very important. In many cases, women will have thyroid nodules. These are hot nodules, benign, but that's also an expression of some form of an imbalance. Usually it's iodine deficiency or some kind of other metabolic imbalance that leads to thyroid to grow kind of outside nodules. And then again, we're looking at lymphatics, which is also very important. Sometimes there's lymphatic congestion. Is this lymphatic congestion just because you had a flu 2 weeks ago, or is this something chronic that's kind of dripping from your dental issues? So when I ask people, and I want everyone to understand this, when I ask people, how's your dental health? I don't mean how frequently do you go and clean your teeth? I mean, maybe it's important, but it's irrelevant to this conversation. There is periodontal disease. There are cavities that are filled to this day with mercury that are deadly. Then we have root canals. Then we have, as I said, mentioned to you, periodontal disease. So that's basically the scan. And then, of course, we take different views to make sure that we're not missing anything. So that pertains more to cranial, dental, thyroid scan. And from there, we can make recommendations. If we see something unusual on one side versus the other, we'll say, look, I can't say exactly what it is. Is it your gum? Is it the inside of your cheek? Is it your specifically your dental issue pertaining to your tooth? But you need to go and get a physical examination with your dentist, and hopefully your dentist is a biological dentist. And I know these are difficult times, and not everywhere you will find a biological dentist, but do your research and make sure that the dentist understands the connection between dentistry and overall health. And usually what I would do is I would call the dentist off and say, do you do root canals? And if the answer is yes, I would say that this is probably not a biological dentist. Okay. More and more dentists actually are starting to move away from putting things like mercury into people's mouth. Some still do. And just because they're taking mercury out and putting porcelain in, it doesn't mean that it's the right thing to do. In terms of porcelain, porcelain could also be estrogenic. So you need to work with a dentist that understands this and checks for the type of materials that are what's the word I'm looking for, that your body accepts, okay, that you're not really rejecting a particular material. So some people will have certain tests. You can even go to other places, like in Toronto we have a thing called Red Paw, where they use electrodermal screening, checking you for different dental materials. Okay. You should investigate this, what you have available in your area.
Right. Yeah. Yeah, I'll follow up with you on that after the dental screening thing.
Okay.
I'll share that out with people. So just to follow up real quick before I jump into the next question as well too, on the thyroid, right? So I don't mind sharing my story with people. And certainly, when I was going through my issues, I had found out that I had thyroid issues through thermography. And it was interesting because I had my blood work done, and it came back that everything was within normal range, right? But that's what I learned. And so for everyone on the phone, right, I work with a lot of doctors here as well too. And at the end of the day, doctors are taught disease management. So if you're not in disease stage, there's not a lot that they can do to help you. But what I learned through going through thermography was that I was having thyroid issues. And it was interesting because I've always been a very high energy person. And then all of a sudden I was ready to go to bed at 10 a.m. I mean, I would sleep my 8 hours and, be dragging myself out of bed. Whereas before I'd be, up at 5:30, and I'm one of those irritating morning people that I love the mornings, and I would be up and, doing my exercise. And then all of a sudden I became this person that was so lethargic and could barely, at the time I was working in my corporate job, and I could barely function. And by 10 o'clock, I was literally laying my head down on my desk, wanting to go to sleep. So, having my scan and then understanding that my thyroid was out of alignment, certainly helped me to be proactive and, do some preventative maintenance, right? And understanding that I was very low on iodine, and certainly, that helped me. And not that everybody would be the same boat, but for me, it was interesting to see that difference. So again, we always say things like, disease, detection is important, but prevention is key. And that's what I find that, what we do through thermography oftentimes allows people to be more proactive about their health and what's happening in the body before disease sets in. So thank you for that. If that didn't answer your question, please just post and we'll get to it. Let me just scroll up here. So we have a comment. I had a 15-year-old root canal removed that my new holistic dentist found to be infected without my knowledge or having any symptoms. And she shared that she believed it was contributing to an autoimmune condition that she's had, has been diagnosed. She's a huge advocate of this. Thank you for mentioning. We have a question, or maybe a comment, but the link between emotion, trauma, and breast conditions. As an example, German New Medicine.
Mm-hmm. Yeah, years ago, I got connected to Dr. Hammer's theories and his ideas. I come also from a place where I find that the psycho-emotional state is probably the most important thing when it comes to one's health. We live in a world where, it's very difficult to quantify a psycho-emotional state. So it's much easier to say, take this vitamin or this herb or this pill and you'll feel better. And sometimes it could be very effective. But when it comes to psycho-emotional state, absolutely, trauma, all sorts of, and I'm not talking about physical trauma, I'm talking about emotional trauma, has affected people, and it depends how you deal with this. It's not really what happened, it's how you interpret this in your mind. Look, if I say I love you, your hormone state will change. And if I say I hate you, your hormone state will change as well. Physically, your biochemistry will change if we could measure this in that instant. So yeah, absolutely. Trauma, psycho-emotional health is very, very important. It's at the pinnacle of it all. Not to say to neglect everything else. You still need to eat and you still need to exercise. But, it's very important what you say to yourself as well, because we tend to filter what other people are saying to us. So someone may like us, dislike us, they will probably deal with that. But it's what we say to ourselves on daily basis. And I have to be honest, in the past couple of weeks, as we're all kind of quarantined, I'm not really kind of very excited about all this. I'm very annoyed and I'm very skeptical and I'm gloomy and all that. And it definitely takes a lot of energy out of me. And so, if someone is in that state for a long period of time, for sure, it's going to affect their health and definitely will lead to disease.
Yeah, I agree. Let me just see if there's any other questions. Is there any connection between plastic surgery to make breasts bigger and breast cancer?
Very good question. I haven't found that in my kind of clinical experience that there is. But any kind of structural change has some degree of risk, maybe very, very small risk, but definitely there's a little bit of risk there. I know that these women are a little bit more challenging in terms of our analysis because, as I said, if someone has been structurally changed, I don't know what's normal for them. Right. But so I don't want to say no, but at the same time, I don't want to say that there is a connection because I really don't see that myself. I think the rate of breast cancer is probably very, very similar to someone who hasn't had any breast reduction or implants.
Right. Another question too, I know that I've been asking you this one to help me, but that is finding a bio dentist here in our location.
Yeah. So again, you can look at a website of IAOMT, International Academy of Oral Medicine and Toxicology. Mm-hmm. If there are no listed dentists in your particular area, maybe you can call around other people that have found maybe these people or practitioners are kind of practicing very similar dentistry, but not necessarily registered with this organization. So I'm not sure I can answer that question. I mean, not everyone who is a member of IOMT is someone that I would recommend, but that's, but generally, it's a great group, and I find that at least they're not going to be stuffing mercury into your mouth.
Yeah.
That's at the very least.
Right. Yeah, true. Right. Absolutely. So we have one panelist that's on, or one attendee that's on here, and she's going to send me the name that she has of somebody in St. John. So we'll do some checking out of that. So thank you so much for that information. And she shared that they also send you for muscle testing to test materials that you are most compatible with. So thank you for that. I will definitely check that out and investigate, and then send it out to folks as well too. So much appreciated. All right. So any other questions, please feel free. We've got another 10 minutes. While we're waiting for any additional questions to come in, is there any other topics that you wanted to be able to touch base with people on today?
In my experience, other than, as I said, psycho-emotional health, that is very, very important to overall health, definitely breast health. Maybe we can touch base on women's hormones, because probably most of the people listening to this are women, probably in either perimenopausal or menopausal kind of age. And perimenopause officially is defined as 15 to 20 years prior to cessation of menstrual cycle. So that's a wide net.
Yeah.
Right. And what happens really, kind of Mother Nature kind of slows down the production of sex hormones from women's ovaries. And as they get past the menopause, now the adrenals will start taking over in terms of producing these hormones. The hormones are needed. You may not need them at the same level as, let's say, an 18 or a 20-year-old at the age of 45, but you still need hormones. So conventionally, doctors will say that, well, after menopause, you really don't need, of course, all your hormones will drop, and don't worry about it. Well, we should worry about it, because it has to be in balance. Because of the environmental influence of xenoestrogens, because of our food, cosmetic products, and everything else, I think most people understand this, that we are living in a cesspool of toxicity that affects us on a hormonal level. In other words, the estrogens are rising, and yet your ovaries, or subsequently postmenopausally, your adrenals are not pumping out enough progesterone. So estrogen is an exciting hormone. Progesterone is the opposite. So estrogen grows, progesterone says, no, we don't have a pregnancy, we're not going to grow anything here. Estrogen says, I have PMS, I'm very kind of teary, and I'm very sensitive, and all that. And that's the so-called PMS is basically an estrogen dominant state, right? Whereas too much estrogen and not enough progesterone. So I would urge each and everyone who's listening here, obviously, if you don't have symptoms, you don't need to do anything, but do check your hormones, because again, most family practitioners, unless you complain about things, don't check women's hormones, and they should. I'm not saying that they should be doing this on, every month, but at least once a year, you should check your hormones and check your estrogen, specifically estrone and estradiol ratios, kind of E2 to E16 ratio. You should check your progesterone, because just because your estrogens are low and your progesterone is non-existent, It doesn't mean that this is fine. You're still in an estrogen dominant state. You should check your thyroid. You should check your free T3 and T4, very important, not just TSH. You should also check your testosterone. Testosterone is not just a hormone, of sexuality. Testosterone also helps with keeping your muscle tone. Testosterone, I call testosterone is the hormone of ambition. So if your testosterone is low, nothing is going to happen. You just won't have that drive to do anything. And it's so easy to get help in this day and age, and it's so easy to try and get this rebalanced, that yes, you can be in your 60s and even 70s and yet feel and jump out of bed first thing in the morning just like you were in your 20s. Unfortunately, no, I'm serious. And unfortunately, it's the 20-year-olds that are hardly getting out of bed.
Right.
So this is very, very important, not just for your breast health, but your ovarian health. Your women with excess estrogen may have shorter cycles. Instead of 27, 28-day cycles, they'll get 21 or 24-day cycle, and their uterine lining is becoming thicker and thicker and thicker, and that's how they start growing uterine fibroids, right? And just recently, about 10 or 15 years ago, the general kind of treatment for uterine fibroids is hysterectomy.
Right.
Oh, well, you had your children, you don't need your uterus, let's yank it out. That's crazy. It's there for a reason. Let's keep all our parts intact.
Right.
Unless it's a total emergency. There's absolutely no need for this. You can treat fibroids, you can treat all these hormonal issues, including, by the way, it's one of the biggest contributing factors to breast health is your hormonal balance. Okay. So if your thyroid goes and you start gaining weight, and the more weight you gain, the more adipose tissue, in other words, fatty tissue around your belly, the more estrogen that produces, the more it suppresses your thyroid. The more your thyroid is suppressed, the more weight gain, and so on and so forth. Now you're kind of in a catch-22 situation, and yet you go and check your thyroid stimulating hormone, TSH, and it comes back within the normal range. And your symptoms are ignored, and the fact that you just gained 150 pounds in the past year, well, you're probably eating too much. So always blame the victim.
Yes.
It's your fault.
Yeah. And it's just, the thyroid in itself could be a whole new, could be a whole webinar that we could do as well for people, because it's one of those certainly unknowns that, as you talk to people about the importance of the thyroid, that they just thyroid, don't know. I didn't know.
Thyroid, by the way, usually precedes breast conditions. Okay, so if your thyroid is off, there is very high probability that the rest of you is going to start breaking down. Right? Thyroid is like a thermostat, right? But it's not just the thyroid. Remember that your adrenals are, part of that endocrine system. Your adrenals are there too. So as we get into our 40s, 50s, 60s, and older, the adrenals are getting literally tired. And as the adrenals are getting tired, your thyroid is starting to dysfunction. Your adrenal, you don't have to have Addison's disease where you can't really lift yourself off the floor. There's way before that, you can say that it's called adrenal fatigue.
Right.
Now, there are so many issues that I'd love to cover with you. Maybe we can do another session, because I want to talk about vital connection to health as well as breast cancer. As I mentioned, we want to talk about electromagnetic stress, and we haven't touched probably one of the most important things is nutrition, and what can you do, what should you eat, and what you shouldn't eat
Right.
to avoid not just breast cancer, but for the most part, stay in good health.
Yeah. Well, we will certainly do some additional webinars. You and I can take that offline. We'll schedule that. Everyone on the phone, would you agree? Some additional webinars with Alexander Mostovoy? We've got another question, actually. Sorry.
Great.
And yes, please.
Okay.
Would love that. Yes, please. So yes, let's do that. Yes, and another one. Yes, nutrition and breast cancer would be amazing. So we will go ahead and schedule those. I'll send out some additional information as we get those scheduled. We certainly have time, right? And this is the beauty of, I talked about this in the beginning, right? There's always blessings in the gray. And one of the blessings is that we've been able to all be able to slow down a little bit and be able to help support people in this way during this time. So we're very happy to be able to do that. So you can expect to follow up on that. Thyroid, hormone health, and weight gain, Dr. Alex, that's another topic. So I will track these and we'll get them over to you so we can get it scheduled.
Great.
One of the questions that came up is about the cost, I believe. Let me just scroll back up here. So is thermography covered? If not, what kind of cost would a person expect? So all different plans that people have are different, right? Between Sun Life, Blue Cross, Great West Life, whomever you're with. So it's all very different. Because thermography is considered medical imaging, you would have to call your service provider and ask them if they cover medical imaging. But I am happy to let you know that if you have a health spending account as part of your package, in which most people don't know that they have a health spending account, but if you do, then thermography is covered under your health spending account. I know that for a fact. I have called 4 of the big insurance companies, and I also have some of my clients that are having no problem getting thermography covered under health spending account. It is also covered under income tax. If you don't have that coverage, out on my website, there is a list of the fees there, but just to make it simpler, a breast thermography, you're looking at $265 plus tax. And then the various other scans that we do is listed on my website, so you can take a look at that. If not, just IM me if you can't find it, and I'll be happy to help you with it. So we've got 1 minute left to close. So any last minute questions from anybody? Alex, was there anything that you wanted to share?
Just wanted to thank you for organizing this. You know, you're absolutely correct. We have slowed down tremendously. It drives me nuts. Because I'm used to going here and there, and you know, I can't sit in one place for too long. I need to do something. But maybe I need a pill for that. But yeah, it's I can't thank you enough for doing this, because you know, we're all inundated with sad and negative news right now, and it doesn't mean that there's so many other subjects that are just as important.
Right.
You know, we don't have to talk about the virus all day long. We can talk about how to improve our health while we're sitting and waiting for the clouds to clear.
Exactly.
So thank you for doing this.
Oh, I appreciate you coming. And so I'm very passionate about people taking their health into their own hands and becoming preventative mindsets. So whatever I can do to help that, I certainly will. I know that I have to do myself a daily reminder lately because the kids are home and they have chips, and all I want to do is stick my hand into the bag. And some nights I do. So there you go.
Right.
In any event.
Wait till they go to sleep and then steal their chips while you're watching Netflix.
Exactly. Anyways, thank you so much for your time, and everybody who joined today, thank you so much for your time. And please stay tuned. We will add some of those wonderful topics that you all asked for today. So I greatly appreciate it. So thank you all.
Take care.